Thank you, President Hahn and Provost O'Connor, for the invitation to join with your esteemed faculty and staff to address your graduates and their families and friends. Greetings. Because of the COVID-19 pandemic, this is the first time I had to pre-record my speech. And I also know that this is not how you imagined this day. I understand the illusion of wearing that regalia, walking up to the stage, and celebrating with your friends and family. And I wish I could say something here today that would make everything right. But all I can really say is that life will throw you curveballs, and it's okay to take a moment to be a little disappointed or a little angry. But after that moment, we all need to accept, adapt, and continue working to improve our lives and the lives of others. This is true for all of us, and it may be easier said than done. For instance, having this recorded means that I need to make sure my speech is really good. Otherwise, you can just fast forward through this at more than 1.5 speed. In what seems like a mere blink of an eye, our entire reality has transformed. But before talking about what has changed, let us focus on what is not. What is not changed are the emotions of this moment. Joy and pride at your success, excitement, tinged with apprehension at your future. What is not changed is the passion and hard work of the university faculty and staff who are educating, nurturing, and advising a new generation of health practitioners and health scientists. What also didn't change was the amount of tireless work that every one of you graduates had to complete to earn your degree and join the ranks of hopeful, optimistic, hardworking, exalted health professionals already trying to make this a better world, and the support you received on this path from your family, friends, mentors, and loved ones. Though the essential things have not changed, we are living in a time when all of us are experiencing firsts. This is the first, and trust me, the only time in history that Dr. Anthony Fauci could become a sex symbol. And this is the first time we are asking people to save the world by sleeping in and spending the day in their pajamas. But those firsts are often the things that make memorable moments in our histories and change the course of our lives. I remember the first time I responded to an Ebola outbreak in Zaire, 15 years after the recognition of the disease. This was shortly out of my fellowship training as a disease detective at the Centers for Disease Control and Prevention in Atlanta. Despite the great training and my wonderful mentors, I was woefully underprepared. The first cryptic messages were of deaths among an order of Italian nuns serving in Kikwit. We found an abandoned hospital, except for a ward of sick patients. Many of them were healthcare workers, being tended to by a pair of healthcare workers who were also sick. I had never experienced a setting without running water or power, let alone a hospital. Fear was so overpowering that families had abandoned their loved ones. The only not Ebola patient was a man in a full body cast who couldn't flee. My mentor, Dr. Roland, got to rehabilitating the hospital and stopping all subsequent nosocomial transmission. In the late afternoons, I would help collect samples from patients while wearing PPE. It was stifling hot, and there was sweat dripping down into my glasses, and I was always worried about a needle stick injury. And sometimes I'd have the opportunity to just hold the hand of a patient. During the days, I was excited as I eventually traced the outbreak back to a charcoal maker, patient 0, who had died many months earlier. This excitement more than offset any physical or emotional inconvenience, including my frustration at having to use a translator given my ineptitude and continued ineptitude with French. As I tracked Ebola cases, I found many more malaria and typhoid cases, which was not deemed sexy enough or interesting enough for an international response. But their suffering was important enough for me to devote the rest of my career to global health. And that's how I found myself in Singapore in 2003 responding to SARS, the original novel coronavirus, that was so frightening that we refined and updated our isolation and quarantine strategies for this century as part of my longer journey to prevent the next pandemic. During the current pandemic, for the first time in recent history, We are all going through the same crisis at the same fears at the same time. A virus reminding us that we are all equal as humans, yet also exposing our social inequalities alongside lapses in our public health and healthcare systems. We are seeing increased disease amongst Blacks and Native Americans and cannot ignore that many lack healthcare or paid sick leave, which brings to mind Dr. Martin Luther King's note that, in a real sense, all life is interrelated, all men are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. This is the interrelated structure of reality. After this pandemic, medicine and medical science will never, ever be practiced the same again. The current model was already non-sustainable, expensive, inefficient, inequitable, too focused on specialty care, and often dangerous. U.S. healthcare costs in 2019 were $3.5 trillion. By 2027, healthcare was projected to account for 1/5 of all GDP in the United States. Unfortunately, despite this investment in health, we have some of the poorest health indicators. In contrast, during the current pandemic, we are seeing a marked increase in telemedicine, remote monitoring, and use of online tools. We have also seen the return of the home visit, drive-through nasal screening, and even drive-up OB care. All ways to improve access to care and a clear admission that we have strayed a long way from a patient-centered healthcare model. This better model of healthcare aligns well with the strong focus and traditions of Kansas City University graduates on primary care, biomedical science, and bioethics. Every time humanity faces a crisis, new champions arise, the new heroes. The healthcare worker, face bruised from wearing a mask for 10 hours, exhausted from looking after too many patients who need them. Captain America, Thor, Black Widow, and even Iron Man, pale in comparison. Their great heroics on the big screen seem less impressive as we see our real-life heroes on the battleground of this pandemic. As you face your new challenges, remember them. Remember the healthcare workers who lost their lives caring for others. Remember the grandparents whose stories we won't hear again. Think of every soul we have lost during this pandemic and honor them. Honor them by learning from them, by keeping those they love safe, by being kind to one another, by going back to fight the battles they cannot fight anymore. And remember that what you do every day has an impact. We are stepping through a portal from a world we knew to one we, and especially you, will create. This burden has always been true, but never more so now than ever. I usually end a speech with a charge to go out and change the world. But the world has already changed. So let me end with a question. What does this moment ask of you?